A pleasure to have you join us today on the program, Healthy Living. I'm Adesu Wausa Owagie. 4th of February every year is that day that is set aside specially to create more awareness on the issue of cancer. And I know that quite a number of us women, especially, play lip service to that word cancer. And a lot of women die too as a result of that. Men do die too as a result of cancer, particularly when these two genders do not present on time. Early presentation is key to you getting a successful treatment. But if you present when it's late, well, palliative is what will be done. So what happens when you present late? What happens when you present early? How are you going to make it so possible for yourself to make sure that you do not come down with this ailment? Is one of those things we're going to be talking about today. Cancer, causes, treatment, possible management, and prevention. More so when we have some beautiful ladies and a gentleman in the studio here to talk about it. Let me introduce my panelists. I want to start with Dr. Lucy Eriba Idese, consultant radiation clinical oncologist from the University of Benin, and she is also past president of M1, that's National Medical Women Association of Nigeria. Happy to have you join us, Doctor. It's been a while. You abandoned your sister. Maybe so, Doctor.
Good afternoon.
You know.
Thank you for having me.
Okay. Nice to see you again. Okay, seated beside Dr. Idese is Dr. Evaristus Obo, consultant radiation clinical oncologist from the University of Benin. Happy to have you join us, sir.
Thanks for having me.
All right, seated beside me is Professor Caroline Omoti, consultant hemato-oncologist. I hope I got that right. Yeah. Hemato-oncologist from the University of Benin Teaching Hospital. And she's also a member of Nigerian Medical Women Association of Nigeria. Happy to have you join us at that National Medical Women Association. Yeah, happy to have you join us. I'm used to calling people M1 because the name is kind of very sweet. Okay, 4th of February every year is that special day set aside to create more awareness on the issue of cancer. Dr. Lucy Idese, let me ask you that question. Why is the world setting aside that day? What's so big about cancer? What's so small about cancer?
Yeah, you know, cancer, it's a disease right now. If I could call it an epidemic, it's really so rampant now. And there seems to be some level of non-awareness by people. People don't seem to understand the gravity. I presume that is why also they come late, because they don't know how serious it is. It's just like everything going on right in the system, and a cell just goes haywire and begins to spread all over. So when they come early, when they present early, you cannot tell them, okay, this is what you are supposed to do. And they also know that if they come early and start treatment early, at least they are very sure of cure. Okay. So we need to let
there is cure if we start early.
Yes. Early detection actually saves lives. So we need to let the people know that this cancer is not about death, because in those days, when you just get that diagnosis of cancer, it's like a death sentence. So we need to let the people know that no, there are things you can also do to prevent cancer. There are things you can do when you detect it early, you come to the hospital, and there are also treatments available. So we need to let the people know that these are the things that are going on right now. Advancement in technology, treatments, and all that. We need to let the people know. That woman in the market, that woman on the street, she doesn't really know. She might just have a problem in her body now, and she will not present to the hospital. So we need to create this awareness. She goes to church, she goes to many places. So this year, the theme now is closing the care gap. It's been on for about 3 years now.
Closing the care gap.
Yes, because there's a gap between the sufferer and the caregiver.
Serious gap.
Apparently. So we need to close that gap. And the sub-theme for this year is that we are calling on the government. Together, we are calling on them to come up and set strategies, put things in place to really help these people suffering from cancer.
Okay, I'll take you on later on the issue of involving the powers that be in all of this. Let me come to Dr. Obo now. We talk about cancer all the time. Like, how many cancers do we have? How many type of cancer can one suffer from? Men, women?
Okay. Thank you very much. Like we all know, what actually cancer, we'll start with what the definition of cancer is. Cancer is just actually when there's loss of the normal cells that regulate cell growth. Every cell in the body has a cell that regulates its growth. Whether it's in the brain, whether it's in the skin, whether it's in the cervix, whether it's in the lungs, or in the colon, or in the breast. When there's that loss of that regulatory gene, the cell now starts growing abnormally.
What is the cause of that loss?
It's actually many factors. We have what we call etiological factors. They are genetic factors that are known for it. So it's a combination of those genetic and environmental factors that actually cause it, that are predisposed to it. So when the loss of that factor, you don't start having the cell growing abnormally. Let's say the cell actually now is in the skin. Just one cell starts growing abnormally, then compression of that tissue around it, it can cause compressive effect, increasing the size. Later on, that starts spreading. That we call hematogenous spread to major organs in the body. Go to the liver, lungs, brain, and even bone.
So every part of the body can come down with it.
Can have cancer. Can have cancer of the breast, cancer of the brain, cancer of the bone, cancer of the skin, cancer of the eye, cancer of, just name it. So,
and it's not spiritual.
It's not spiritual. It's not spiritual. But now we have some of the very common cancers we see worldwide, which I'll explain briefly now.
Please.
For females, it's breast cancer. Then for males, it's prostate cancers. You know, other common cancers too, can talk about, I think, like colon cancers, you know, lung cancers, head and neck cancers. They are all common cancers we see, cervical cancers, you know. So, but having said this, we must understand the fact that it has not shown with spirituality or attack like you earlier mentioned. The genetic process, the etiological factors that actually initiate the process of carcinogenesis, which now leads to cancer. Cancer, the word emanated from crab. You know what's called crab. Why? Because crab can move in any way. Can move to the front, to the back, left, right. That cancer moves too. Cancer of the lungs can go to the brain, can go to the bone. It goes anywhere. There's no regulation. Once you have that disease to that extent. So that way what comes from crab can go anywhere. So it can actually with metastasis. So it's not about spirituality, it's not about spiritual attack. The genetic process often enhanced by some etiological factors.
All right, thank you so much, Dr. Obo. Let me come to you now, Prof. Let's look at Dr. Obo did tell us that cancer can come from anywhere. Let's look at the common ones that happen to women. Okay, let's say if you take one, let's look at breast cancer. How does it present?
Okay.
Because that's one of the commonest cancer that kills women faster than you can think about it.
Okay. Thank you very much again. The breast, ideally when you look at the world, the breast cancer is the commonest cause.
Commonest, yeah.
Yeah, commonest. The statistics actually shows that 72,000 of Nigerians, as of today, by yearly, they have cancers generally. Yeah. And when they pull this together, 72,000 in Nigeria, yearly,
Nigeria alone.
It's a frightening thing to tell you that it's really big. Now, the breast cancer, coning it down, is for the females, of course. And how do these people, these females present? Usually, we found out that most of our patients, they come very late. Now, it starts early.
Okay.
Like we've said, prevention is better than cure, right? And that's where the origin of screening early comes in. Because when you have it, you don't even know. And that's why you see many
signs, no symptoms
at that initial stage where it can be picked up and then it can be cured. So how do they start? How does it start? Usually there is what we call a node, a lymph node. We call it like a seed, that lump that presents at the breast. And that's why we are being enjoined. Women frequently, it can be maybe on the day of your birthday, you self-examine your breast. because it comes as a tiny seed. We call it lump in medical term, like a seed
In the
appears
breast.
in the breast. Then it may not even show the breast, it may be in the armpit, the axilla.
Okay.
Yes. So that's why when you are, maybe like for example, you have to examine yourself regularly. Comes in the axilla, we can then of course in the breast as a seed. Well, now when you see that one, with the regular checkup you've been doing, you can immediately inform or go to assess the medical officers to at least for the screening, and then from there to see the. So it's mainly the seed. Then as you look at it over time, it may swell. You may see that one breast is bigger than the other. So when we as females, we are looking at our mirror every time, no powdering and doing all those ways, you look at the breast. Are they the same size, or is one bigger than the other? Once you see it going like that, you know there is something ongoing. Normally, of course, one breast is slightly.
Okay, I was
but
gonna
then-
say that.
No, one is just there. But when you see that obvious one, then you will know that there is something. Then you know there's what we call orange dopel. Like the orange that has those seeds like
Yeah.
at the nipple. You will see it. Then the nipple itself may go in retracted inside. So you know that these are some of the signs coming. It may even start bringing out fluid. I mean, you are not a pregnant, a nursing mother, you see fluid coming out from the nipple, maybe bloody, maybe milky. So those are some of the symptoms and signs you will see.
Okay, let me go to Dr. Obo now. Let's look at the male. I understand that male do have breast cancer too, but it's not that common. Now let's look at the prostate cancer in a man. What are the signs and symptoms?
Okay, prostate cancer, like I earlier mentioned, is the commonest cancer we have in males, and also the highest commonest cause of mortality. How would they present normally? Usually, we have something that actually also looks like prostate cancer, which is also not actually malignant, but is called BPH. That's not cancer of the prostate.
Okay.
You may have that and be unable to actually pass urine. You may
Okay.
have things like maybe poor stream and all that. And to that, to an examination, they probably will say this is BPH
Okay.
with a scan examination, so they can do a surgery to take out the prostate. But for cancer of the prostate, one, you have elevated PSA.
Okay.
PSA will be high. It can be as high as 50 up to 100. Some
What's the normal?
normal is it should be less than 4.
Less than
For
4.
less than 4, should be less than 4.
Wow.
Yeah, less than 4 to less than 4. Maybe between 4, 5, but less than 4, 5. That should be 0 to 4.
So what
But-
is above?
Yeah, you now have it as high as 35, 50, 100. These are red flags. These are red flags. So if you had a kind of high PSA, then you have to further go and investigate what is happening. Because that things can also cause high PSA, but not to that level.
Not to that level.
Things like prostatitis, inflammation of the prostate can make you have high PSA, but not that level. So, but that high, like 200, 150, 90 are obvious red flags. You now go call ultrasound scan. Ultrasound scan will now show the nature of the prostate. How does it look like? Then you now actually have a physical examination by a physician, doctor, who will do what called DRE and check how the prostate feels. Is it nodular? Is it hard? Is it irregular? That will make a diagnosis. But for the patient, he will just say, oh, I can't pass urine. I have difficulty passing urine. The stream is poor. I have urgency. I have incontinence. Maybe you go on to one where you go there, you rush there, nothing comes out. At the time before you get there, you can weigh yourself. There's incontinence, there's urgency, there's urgent incontinence, as you can see. Then for those that actually have advanced very much, that have gone beyond the capsule, they can have bone metastasis. The cancer of the prostate goes to the bone very commonly. That is side it goes to very commonly. How would they present? Severe bone pain, usually back pain. You say, my back is as if it's hurting so much. I see there's something hitting me there. The two bone mainly are the pelvic bone and the vertebral bone. It goes there very commonly. So those will not have what was of severe pain, they're unable to walk very well, they can't move around, and some say they can't actually even stand their feet because of the severe pain. So usually that is symptoms of an advanced prostate cancer. But for the early stage, as I mentioned, and they have it caught early and they do surgery, most times that suffices, they're very okay. But for the advanced stage, that we have other treatment like chemotherapy, radiotherapy, hormonal therapy. for the control. So I will say cancer gotten earlier will cost you less and would also have better outcome. But stage 4 cancer will cost you more and you also have more problems with treatment. So general patients are facing problems with treatment toxicity and financial toxicity. You spend money and the treatment itself is also toxic. So you are facing multiple challenges here. Treatment has its own problem, money has its own problem. So we normally say, let patients present early for screening and get these cancers at early stage where they can have radical treatment with the aim of cure.
Okay.
That we have in foreign countries. Why? Because they do screening routine. They call it medicals. They don't have to have symptoms. Just go and check, and most times, if there's anything at all, it's picked early, and they can be cured of the cancer. Like Dr. Ronald said, cancer is curable when seen early and treated aggressively.
Okay, I was discussing with a group of men, and they said that to prevent cancer, a man has to fire all the time. You know, just indulge in sex like between 21 and 25 times in a month. So I asked the guy, you want to kill your wife? He said no. Like, it has to be between 21 and 25 times in a month. That is a preventive measure. How true is that?
I've also heard that, but it hasn't been proven scientifically. People just like more hypothetical, people just say, oh, this thing was tried somewhere, it worked. Somebody with the study of people that had prostate cancer, and we found out that most of them have cancer were not involving or were not ejaculating. So that's based on that. We think the reason is because they didn't have too much sex, but that may actually have contributed to it. You understand? Okay. So it's not absolute. So that's why you can't use that to judge. You had this one that was done over 20 years. People that you saw that had prostate cancer, you're not asking questions. How often were you having sex? We say, perhaps maybe like 2 times in a month. Oh, not. So it doesn't give a true picture. Okay. It's not representative. So for me, that is not scientific.
Perhaps an excuse for
exactly. So there are other factors that will not consider.
It's actually a myth.
Yes, it's a myth. Yes, and so for me, I will not subscribe to that. And I think if you say that you are pushing misinformation, it's not proven scientifically. And we are all scientists here. That doesn't fly with us.
I hope that my friend is watching. Okay, Dr. Idiase, let me ask you now. I've asked a prof about breast cancer. Let's ask you about cervical cancer. How does it present? Because that's another killer for women.
Yeah, cervical cancer is actually the commonest gynecological cancer. Ab initio, when it's presenting, initially it may not even have any symptoms, but it is now when it is progressing. That's why we talk about screening. Because if screening is done, it shows there's going to be changes. You see it at that point. And it takes between 15 to 20 years to become cancerous.
Wow.
Yeah, so that's actually a good time for people to do the right thing and don't come down with cancer.
So what's the right thing to be done?
Yes, once you see that there's a pre-malignant lesion, of course you go to the hospital and certain treatments will be given to you and the patient is apparently good and cured. But when it's now getting to full-blown cervical cancer, the commonest presentation is abnormal vaginal bleeding. For those that are still menstruating, they find out that they menstruate more than maybe 2-3 times in a month, and it comes in large volumes. But then for those that are no longer menstruating, that's the postmenopausal women. Somebody that has probably become menopausal maybe 2 years, 5 years, 10 years ago, all of a sudden, she just starts seeing blood. Like I keep on saying, it is not time to say, testimony time, maybe I want to give birth to more children. No, it is cervical cancer until proven otherwise. All pre or postmenopausal bleeding. Okay. That's the commonest symptom. Then you can also have foul-smelling vaginal discharge. The patient begins to pass out some foul-smelling discharge from the vagina. It's also a sign. And many times, you also have what we call postcoital bleeding. After intercourse with your spouse, normally you should not bleed. But when the person has sex, the next thing you start bleeding. Postcoital bleeding is another sign. Sometimes you start seeing people, they come down with waist pain. You know, then by the time it's getting more advanced, you start having things like swelling of the legs, we call it edema. patient, it can spread too. Like it's of course, the cancer, it can get to other parts of the body, it can get to the lung, person start having chest symptoms, it can get to the brain, start having brain symptoms, it can get to any part of the body. So when anybody, any woman starts noticing that, you know, that pain, or sometimes pain when you are having sex too, which is not normal, then you know that there's possibly a problem.
Wow, this is huge. And unfortunately, most women do not have this culture of accessing medical services, whether it is cheap or not. It is not in the culture of women.
Yes, women would rather save money to be buying Ashwebi and some other things. It's actually advocated that you save some money, no matter how little, for your own health care. And you really don't have to be sick. You really don't have to have that symptom before you access health care. Screening is very key and very important in the prevention of cervical cancer. And it's one of the cancers that is still very curable if caught on time.
Women are usually very sympathetic to other persons. We have this empathy in us, inbuilt stuff in us. And I know that M1, you used to do some free screening and all of that. You didn't do that for the populace this year?
Oh, yes. Tomorrow, they are flagging it off.
Free screening?
Yes, at the doctor's house. Free screening for
every woman.
For every woman. Just that you get there on time and get a number. Being sponsored by the Medical Women Association of Nigeria, Edo State. For all women. Free screening at the doctor's house.
Okay, so if people come there, they don't have to pay.
No, they don't have to pay.
There is this thing about women. Women are usually indigent.
Yes.
And even those who have spouses who can help, they don't usually come out to help until it is an emergency case. That's why you see the man running up and down.
Yeah.
Say, and I have this money somewhere, but you don't want to spend it. Okay, talk to men over this.
Yeah, true. That we'll speak to the fact that cervical cancer is the commonest cancer. And women, I won't feel women down south are even a bit fortunate in terms of accessing healthcare. Like up north, a lady has to have the husband's permission to go and get healthcare. And there are times that they are denied.
Okay.
So I know what that means. You have cancer, maybe there's a cancer, you have the cancer, you definitely progress.
Okay.
So we up here, a woman can say, fine, I'll go for my healthcare. And I don't see our culture really holding them back, unlike up north.
No, I'm talking about the men that are like this. You know, rather that.
Yes, but I think it's still personal. I think yes, but I think if your wife is healthy, your family is healthy. Okay. A healthy wife will take care of children.
All right, briefly, we're running out of time now. Let me ask Prof. now. You are a woman, I'm a woman. We are very religious. The first port of call if a woman is sick is the pastor. Pastor. It be like say one thing, reverend. It be like say like that. Please talk to the women that cancer and religion are not friends.
Oh, well, for the women, I want to tell, it's not even only the women, anyway, everybody, that when you see some of these signs and symptoms we've talked about, that you need to assess the medical facility. Now, if you want to talk about religion, Luke was a doctor who wrote a part of the Bible, a chapter in the Bible. Are we now saying that there is no place for the religion aspect? There is. The religion is there. The medical aspect is there. Nothing stops you from assessing that. While you are taking your medication, you can also be praying about it.
Okay.
There is nothing wrong in that. God will not hold you against it.
You know, I said this. I was in a hospital sometime. In fact, I was on admission, and a baby was rushed in after being taken to church. The baby started convulsing, like according to the because I was by the window there. The woman was like, since morning the baby. Okay, the man was not, quarreling with the woman. Instead of taking this child to hospital, you take this child to church this morning. And when water don't pass Gary, they were advised by the doctor to take the child to UBTH. So they drove all the way from Ogara to UBTH. But by the time they got here, of course. So we should also talk to some pastors too, just like you said, there's a place for religion, there's a place for health. Dr. Idiase, as we round up now, what's your message?
The message here is that cancer, if detected early, can be cured. And we have a lot of people that have been living with cancer for 10, 20 years and even more.
And they are okay.
And they are alive and well. Why? They detected it early, they went to treatment, and they did not say it is not my portion. If it's not your portion, then whose portion is it? So once it has come, just face it, go for treatment. And we also call on the government, because that is a sub-team for this year, that together we call on those in authority. We call on those who have the yam and the knife together. And they should please, let's try to close this care gap in cancer care. Cancer is very expensive. We know the government has put some things in place like the Cancer Health Fund, which we will announce publicly to everyone, that there's a cancer health fund for indigent patients, where the government pays 1 million naira into an e-wallet for the patients.
For indigent.
For indigent patients. And it's for breast cancer, cervical cancer, prostate cancer. Other cancers, we want them to still put those ones into consideration.
Only in government hospitals?
Yes, it's in government hospitals.
Okay.
For now. So the appeal also is that it should get to everywhere.
Okay.
Especially those people that are out there that do not have funds.
Okay.
And also when that 1 million is exhausted, you can also go again for another 1 million. So that is ongoing. We also need more from the government to make this thing work.
All right, gentlemen and ladies, this is where I say thank you so much for finding time to be with me on the show this beautiful Monday afternoon, with the hope that that woman out there, that man out there, will take a cue from what we've done today to assess medical care. Your health is in your hands. Thank you so much for being here. We'll see you again on Monday. Bye-bye.